Hello, my dear future nursing officers. Welcome you all to the master nursing classes. So, you people are waiting since from the yesterday for this particular video solution for the most authentic and the accurate answers for your mains exam. So, once again, I am in front of you all. So, thank you so much, first of all, for you all for your huge love and respect towards the master nursing classes. And whatever the trust you people shown on the master nursing classes, hope it is very much helpful to you all in your exams. So before the exams, I told students you all already have practiced the questions which will reflect on your screen, right? So many of you all already called me and telling, sir, by seeing each and every questions, I were remembering you, sir. Yes. So because I told before the exam that these are the important questions and these are the important concepts you need to remember and you need to practice before going to the exam. And wherever I told it was important, that questions, that concept have been struck in your exams, right? So that is what a experienced person or the experienced teacher takes the classes during the exam time. Students, the most important thing during the exam time is the hitting the every core area of the important point. So I have did my best. That is, I have taken the important question from the pharmacology. The questions have been struck in the exam. Important question from the research. That is the retrospective study, prospective study, cross-sectional study. Okay, so that one I have discussed just 2 or 3 days before the exam. That is also struck in the exam. Okay, so many more questions. The OBG questions and the psychiatric questions from the master batch. Wow. Same questions with options. Students have felt very much happy. So that is what actually a teacher have. As a teacher, we want, right? So we are putting the effort and the students are believing on us and the students are practicing the content what we are giving and that is striking in the exam. So this is, I think, more than enough, right? So yes. So let's begin the session of the solving the very important questions which were came in our Norcet 9 mains exam. Okay, dear students, whatever the questions I have collected here are the purely memory based questions. I have tried my best to bring all the same options in front of you all, and I am giving my best shot in this particular session again. So here we are not only discussing the what questions came in the exam, just I will try to revise all the key concept again in front of you all what we have discussed in the previous sessions as well. Okay, yes, so already exam is over and we hope for the best result. Okay, and who all are not qualified the prelims and who all are watching the questions, what are the questions which were came in the mains, students, as compared to your prelims exam, mains was easy. So prelims only was the toughest exam and the mains was the easiest exam this time. Okay, so yes, so what are the questions came and what are the correct answer for the each and every question we will discuss without wasting a time here. Okay, so this was the question which was came in your exam, right? During the CPR with the advanced airway in place. Okay, so already advanced airway is there in place, means IT2 or the supraglottic airway, anything, the advanced airway which was there in the place. Okay, so what is the recommended ventilation rate for the adult patient? Okay, so this is the question which was came in your exam, and there were the options which were telling the 10, 20, 15, 5 and 30. Okay, students, and one options was there, that is the 12. Okay, so that is the option which confused every one of you, right? So one option which was there 12 and remaining options was the same, right? So here in this particular question, the correct answer is 10 breaths we have to give per minute without pausing the CPR. Okay, so by continuous compression of the chest, 10 breaths per minute we have to give in the CPR. So this was the guidelines we have discussed in the rapid revision class already. Okay, so the same important guidelines I told in that one also, it was the very important one. All of you have seen this here. So once the advanced airway in place, so give 1 breath for every 6 seconds. Okay, so it means for 1 minute it is 10 breaths. Okay, so that is the very important, without any pause in the chest compression, means continuously we are doing the chest compression without any pause, and 1 breath for every 6 seconds, means 6 seconds 1 breath, means 60 seconds 10 breaths. So that was the important question which was came in your exam. Okay, so hope it is clear. And here is the next question. Yes, dear students, few questions are like that, like what is the viability of the OUM and sperm, like that. This was the easiest questions which regularly you people have been practiced in our test series, and the toughest questions and the scenario based questions, practical questions, everything you have practiced in your test series. That is what you people feeling the exam was easy. Okay, so that is the main thing, just you have to keep in your mind, right? So this is the question which was there in your exam on the prospective or the cohort study, what we call. So here what happening, which of the following is best describes collecting the history and their exposure status. So what all are the risk factors are there? So we are collecting the history from the patient, then we are following the patient, or we are doing the follow-up, and we are observing for the development of the disease outcome. So by holding the risk factors, we are going towards the disease outcome. So I told it before the exam only. Okay, so you can just look at this particular image here. Okay, just 2 weeks before the exam. So we have discussed this class, right? So in this one, I told what happens in the cohort study or the prospective study. Okay, so we will move by holding the risk factors towards the disease outcome. Okay, by follow-upping the patient. Okay, this is what we call as in the prospective study. Means we are moving from the risk factor towards the disease. So that is what we call the prospective study. If we are moving from the disease and we are asking to remember him what are the risk factors he was have previously, so that was the retrospective study. Okay, so this prospective study we also call as the cohort study. And in this particular question, who all are chosen the correct answer, okay, which is not in cross sectional, which is not in like case control, it is not in randomized control trial, it is the pure and the very important MCQ which was asked in your prospective study. Just few days before the exam we were discussed this particular question. Okay, so that is the very important, right? So here is the next question, another very important question. Already discussed question in the previous rapid revision classes. What I have shared, like the classes I have shared in your like WhatsApp channel and group, that these are the important videos. Please keep these videos in 1.5 speed and finish it. So these words, wherever I told, from each and every videos, 2 questions, 3 questions, directly, indirectly, 4 questions came from the one video. Okay, so did you see the CT's interpretation? The question came from the variable deceleration, one question. The question came from the very important like late deceleration, image based question interpretation. Only the master nursing classes YouTube channel has that particular interpretation of the CTG, right? So from there, 3 questions you got from the one video. One is from the variable deceleration in the umbilical cord compression, the clear concept what I have explained, and along with that one, the question which was then image based question, that is the late deceleration. Okay, so along with that one, components of the biophysical score, right? The 3 questions from the one video. So what you want, you people, right? So that is the thing, right? Here, this was the question was there in your exam, and for this one, the answer is the 20 mg of the zinc we have to give for the duration of the 10 to 14 days. The single best answer is the 14 days. Okay, so that is the 14 days. Students, the WHO and UNICEF togetherly says that in a patient with the diarrhea or a child with the diarrhea, so in order to reduce the severity of the diarrhea and to re-epithelialize the intestine as soon as possible, the zinc is most essential element we need to give along with the ORS, right? So that is the reason the question was asked on the 6 months to 5 years during the management of the diarrhea. So the dose of the zinc during the 6 months to 5 years during the management of the diarrhea, as per the WHO and the UNICEF guidelines, so that is the 20 mg once daily for the 14 days was the your answer. Okay, so that was the question already what we have discussed on our rapid revision classes. Okay, so which was we have already conducted previously. Okay, so dose of the zinc in the diarrhea. Okay, so clear, very important. I have mentioned in this video also, you can see the very important one, right? So the child, the age is less than 6 months, the dose is 10 mg, which is for the duration of the 14 days. Similarly, if the child age is more than 6 months, so the 20 mg for the duration of the 14 days, daily once. Okay, so in our question, which was asked from the 6 months to the 5 year, what it means? 6 months to the 5 year means which is more than 6 months. So the dose is the 20 mg once daily for the 10 to 14 days. So this was the correct answer, right? So the next question is here in front of you. Yes. What is the primary concern that should be assessed before administering the morphine to a patient? The 1000 time repeated question in the all the state and central government exam. In our test series, at least we have repeated this question 3 or 4 times, because these questions are the questions which have the highest probability to strike in the exam. You people are beginner to the competitive world, so you know which, like, you are having the less likely to know which questions will come in the exam. But we have well thorough about the all central government exam, state government exam. We know what to come in the exam. So that is the reason we will be completely planned and we will be completely attentive towards the question which will directly strikes in the exam, and we will put those questions at least 3 times in a 6 month of the duration. So you will expose to the same question. So when that question will strike in your exam, so you will be like very happy. So that is the very important thing, right? The most important concern we need to show towards the patient who is receiving the morphine is that is the respiratory rate is 10 here, means the patient is having the respiratory rate is 10 here, means if we give the morphine, so again it will cause the respiratory distress, respiratory depression. So that is the very, very important thing. If the respiratory rate is low, so we should have the more concern about that one, because the morphine is having the side effect of the causing the respiratory depression. The very, very important thing you have to keep in your mind, right? So this was the question already we have asked on the pancreatitis. Okay, so by relation with the pancreatitis. Okay, so in the pancreatitis, the morphine is dangerous. Why? Because so that is the worsening of the pancreatitis it will do by spasming the sphincter of the ODA. Okay, and it's also having the highest risk of the respiratory, increased risk of the respiratory depression. So that is the very, very important thing what you have discussed already in the rapid revision sessions. Okay, so like many times you have repeated in the test series. That's the very important one. Here's the next question. A patient develops sudden dyspnea and options of the breathe sound is there on the right side immediately after a right subclavian vein central catheter insertion. So what is the most likely cause of this one? But the same direct question what I have explained in your rapid revision videos and what I have shared on your WhatsApp and the videos which was there in your Navagraha plan. Same question with the concept clarity. Okay, look at this one, the concept clarity with the complete design I have drawn in front of you all. So this is a subclavian vein and this is the lung. When you will insert this one in the emergency, so the like central venous catheter may penetrate the lung and there is a highest chance of the pneumothorax. So the entire concept by drawing the diagram, so everything I have explained to you people. So that was the highest important thing what you have to keep in your mind. Okay, so that's the patient is having the immediately patient is getting the dyspnea and the absence of the breath sound. Okay, so that indicates the patient have underwent the pneumothorax. So who all are chosen the correct answer? This was the pneumothorax. Your answer is 100% and the 200% correct. Okay, yes. So yes, so here is the next question. A nurse finds that a patient just to have accidentally disconnected. Students, in the rapid revision video, I have told two very important practical scenarios to you people. One is from the site of the insertion, the tube is dislodging. The word dislodging means which is coming out. So I have inserted in the chest. So from the chest which is coming out, so the chest tube is coming out means that time I told you people to apply the occlusive dressing. Right, so here the chest tube I have inserted, and for this chest tube I have connected the drainage tube. When there is a disconnection between the drainage tube and the chest tube, so I told the chest tube tip we should immediately insert inside the NS. So this was the scenario what I have explained to you people. So here is the proof you can see, right? So I told if in case this is the site of insertion of the chest tube, okay, from here the tube is came out. The tube is came out means what we have to do? At the insertion site, we have to maintain the three-way occlusive dressing. Means we will put the dressing there. So in order to prevent the air entry inside the lung. Okay. So if in case, if there is any disconnection between the, so here is the connection between the chest tube and this drainage tube, right? So if this chest tube and drainage tube is disconnected, the tip of this particular chest tube, we need to insert in the NS, sterile NS bottle. So that is the reason we need to keep the sterile NS bottle at the bedside. So complete concept I have explained to you people in this particular rapid revision classes of the master nursing classes. Okay, so this was the question which was asked in your exam, right? So the answer for this one, so look at the question what they have asked in the exam. Okay, so they have asked accidentally disconnected from the drainage system, means the tube is not dislodged here. So the chest tube and the drainage tube what we have connected, that is accidentally disconnected. Okay, so in order to prevent the air entry, here we in middle of this one we have entered one wall, that is the pneumostat wall, that everything I have explained to you people. Okay, so Hemlich wall what we can say, or the pneumostat wall what we can say. Okay, so that one we in order to prevent the air entry, so that one we have connected in between. If it is not connected, so the tip of this particular chest tube immediately we need to insert inside the sterile normal saline in order to prevent the air entry into the pleural space. Okay, so that's the very important. Never ever clamp. Okay, so clamping the chest tube is not a good thing. Okay, it is again causes the tension pneumothorax. Okay, so don't never ever clamp the chest tube. Just place the end of the chest tube in the bottle of the sterile water. This was the a very important question which was directly struck in your important Norcet 9 mains exam. Okay, so hope it is clear to every one of you, right? So here's the next question. During the CPR, a resident intubator patient in a cardiac arrest. So patient is in a cardiac arrest and a resident who is there in the ward, he intubated the patient. So what is the most reliable method of confirming the correct endotracheal tube placement in this particular setting? So what happened during the CPR, if we are sending the patient for the radiology unit for the taking the X-ray, or we are calling the radiologist to come to the ward and to take the particular X-ray to confirm, this is not possible during the emergency time. Students, the clear cut I have explained to you people before the exam only in the rapid revision classes. You can say which method can be used to confirm the placement of the endotracheal tube. So clearly I have explained the first and the best answer is the end tidal CO2 monitoring. So that is also we call as in the capnography. So everything I have explained to you people here. Okay, so what is the cutoff of the capnography and how the waves will form in the capnography, everything we have discussed in the before the exams. Okay, so the best method of confirming the endotracheal tube placement is not just X-ray during the CPR. That is the correct answer for this one is the continuous waveform capnography is the correct answer. So who have chosen the option D as the correct answer, so you have secured 1 mark. And who are not chosen this one, this question is having the highest probability to strike in the next exam also. Please choose the correct answer. That is the capnography is the correct answer. Okay, so which is most reliable than the X-ray. Okay, so that's what we call the end tidal ETCO2 also we can say. Okay, so very important, right? So here is the next question. What should be the ideal length of the BP cuff? So the ideal length of the BP cuff bladder, so in relation to the circumference of the children's hand. Okay, so that is already we have discussed. So at least 80% should be the length. Okay, so you can look at this particular rapid revision video. So for accurate BP measurement, the bladder length should be 80% of the arm circumference and bladder width should be 40% of the arm circumference. So this is the golden point, which was the important point I have told before the exam. So this question which was came in your mains. Okay, this was came in your mains, right? So in the prelims, the question was asked if the BP cup is small, so what is the expected outcome? So that is the false high blood pressure. This was your prelims question. 1 slide, 2 question in your exams, right? This is the specialty of the master nursing classes. Hope it is helpful for you all, right? So who are chosen, that was the 80% as the answer. So in the range it was there in the exam. So that was the 70 to 80%, 40 to 45%, 30 to 35%, 10 to 15%. So the answer goes to the very important 75 to 80%. There is no any 100% is required for the children's also and in the adults also. Okay, so yes, that is the, if the bladder length is means the BP cup bladder length is 80%, it is covering of the arm circumference, means that gives the good blood pressure. Okay, so yes, that is the, I hope it is clear to everyone of you, right? So here's the next question. So the question was asked on the Parkland formula. So they only have given the question, that is the like 4800 ml was there for the first, like what we can say the for the 24 hours. Okay, and in the first 8 hours, so what you will infuse. Okay, so how much amount of the fluid you will infuse. So that was the question. So I told you people, so whatever the outcome it will come, so we need to divide it by the 2. Okay, we need to divide it by the 2. And so 4800 divided by 2 is the one, like it was the 2400 ml for the first 8 hours we need to give. So this was the question which was asked from the Parkland formula, and this is the Parkland formula. And the new Parkland formula, instead of the 4 it will comes 2, but it is not using in the India. So until and unless the examiner will ask the question, use modified Parkland formula. So according to the modified Parkland formula, then only you use the 2 ml. Okay, otherwise you use the 4 ml. Okay, so that's the very important. Still in the India, you are using the 4 ml. Okay, so please be considered in your mind, right? So yes, there is an update. I know 2 ml is also there was an update, but still we are not using in the India. And if the still standard books not have been mentioned that one, and unless officially like using in the India, so we can stick on for this previous question only. Okay, so if he is mentioning, the examiner is mentioning in the question to use the modified or according to the modified Parkland formula, then the 2 ml RL is your formula. Okay, so this is the very important thing, just you have to keep in your mind, right? So these were the very important question which was struck in the exam. Okay, so along with that, the question was like this: a patient presents with the high blood pressure, tachycardia, and the dilated pupils. In response to the pain, which type of the pain is most likely patient is causing this autonomic signs? Okay, so you can say which type of the pain is most likely causing in this one. Okay, so that is who all are chosen. The correct answer is the acute pain. So acute somatic pain or the just acute pain was there in the option. So acute pain is the your correct answer. Okay, so acute pain is the your correct answer. It is not in chronic neuropathic pain, it is not a visceral pain, and it is not a neuropathic pain. Okay, so it is the acute one is the correct answer. Hope it is clear to everyone of you all. Okay, so here is the image based questions which was asked in your exam. The direct question from your master nursing classes just 1 month before of your exam. So in the rapid revision session, I told important surgical instrument for the Norcet exam, special classes by the Nagaraj sir. Okay, so that is the image based questions of the diverse retractor which was directly struck in your exam. Okay, so very important one. And who all are chosen the correct answer of the diverse retractors. So in your bank, in your marks count, one question have been struck. Okay, so here is the question. This was the image which was asked in your mains exam. That is the image based question. Okay, in this image based question, so already in the Prakash sir class, OBG image based important question, the same to same. Okay, so triangular tip wala green armitage forceps, which was already discussed one. Okay, this was the mainly used for the hemostatic. Everything sir I already have been discussed. That is the green armitage forceps is the correct answer. So who are chosen the image second, this one is the green armitage forceps. So your answer is correct one. Okay, so this is the green armitage forceps. This is also directly struck from the exam. Okay, here comes to the questions which decides the ranks. This was the image which was there in your exam. Okay, so first there was the contraction followed by the delayed there is in the deceleration, and again there is a peak of the contraction. So peak of the contraction means there will be a deceleration should happen here. Okay, it is not happening here, it is happening here, means contraction is here, the deceleration is happening here, means this is what you call the late deceleration. Already Nagaraj sir, okay, so have been took the class on the CT's interpretation, very important one. 2 times I have shared this video in your WhatsApp channel and in your WhatsApp Telegram group and all the WhatsApp groups. Okay, so very important. This is the image of the late deceleration. Okay, so I have discussed and all the basic concept, this one to how to remember, interpret and give the best start in the exam. This one also we have discussed before the exam only. Okay, so there is the very important question which was struck in your exam. Okay, so again important for your exams. Okay, from this particular one video, CT's interpretation, there were the 3 questions. Okay, so in the prelims also there is a question from the non-stress test. Okay, reactivity, non-reactivity. In very basic, in very perfect way, I have discussed all the things. Okay, including the prelims and means total 4 to 5 questions were there from this particular one video. Okay, so I am sharing the videos by mentioning the fixed question will come, means the fixed question will come from there, right? So just not for the not like for others. So we will just mention for the namesake. Wherever the Nagaraj sir will say there is a fixed question chance is there, so from there definitely the question will strike in the exam. Okay, so very important. We have discussed this one before the exam only, the late deceleration. So the same to same image based question which was asked in the your exams. Okay, there are the very few teachers this like they have conducted this particular CT's interpretation on the YouTube. Okay, so you can search even a medical lectures also. Okay, they have not given the clarity. After watching this CT's interpretation, if you have the -1 point doubt also, you will get clarity, because the Nagaraj sir will teach for the clarity. The Nagaraj sir will teach for the integrity of the our nursing profession, right? So yes, so here is the next question. So the answer for this one, our last image was the late deceleration. Okay, so this was the next question. A 26-year-old primary gravida at the 39 week of the active labor is on the continuous CTG monitoring, and this cardio topography shows the variable deceleration. What is the most likely cause of this CTG interpretation? So variable deceleration we will see in the case of the umbilical cord compression. So already we have discussed this one. Okay, here was the question. Okay, so variable deceleration we have discussed this one already in your exams. Okay, so variable deceleration. Okay, so what happens in this one? Seen in case of the which happens due to the cord compression. So this was the concept and the golden points what we have discussed before the exam. So this was strike in the exam, right? So the next question is same to same question, same to same options. What is the annual health coverage provided under the ABDM JAY? So our team have been already repeated this question 2 times or 3 times. So this is students, the 5 lakh who are chosen the correct answer. So that is your 100% correct answer. Okay, so this is the without paying any premium to the government. Government is giving the health security to us. Okay, government is giving the health premium, health policy to us, like to like for general population, they can claim the up to 5 lakhs per year per family. Okay, so for their free health checkup and free treatment, everything. Okay, so that's the very important thing. So we are giving the 5 lakhs rupees. So this was the question, and the answer was directly. Okay, so this is just 1 month before the exam what we have discussed the question. So directly strike in your exam, right? So I hope it is helpful for you all. And here is the next question, which is a question which created the confusion among all of you students. Actually, in this question, which of the following is the bactericidal anti-TB drug was the question, and these were the options which was there in your exam. And this all like instead of streptomycin, here I think isoniazid was there. Okay, so instead of this particular streptomycin, here the isoniazid was there. Okay, so almost all you people chosen the isoniazid. Students, remember me. So I told only ethambutol is the bacteriostatic drug. Okay, so here this was the like before the exam. Okay, just 2 weeks before the exam, the same like similar question with the concept I have discussed to you people. Rifampicin, isoniazid, and the pyrazinamide. These all three are the bactericidal drug. But among these three, the maximum bactericidal is the rifampicin. Okay, so actually the question and the option was wrong. If the aims consider that one is wrong, so they will give you a bonus marks. Okay, if they will go according to this rule, like which one is the maximum bactericidal, so if who are chosen the rifampicin as the answer, so that is your correct answer. Okay, as compared to the isoniazid, rifampicin is having the maximum bactericidal effect, so the bactericidal effect is maximum, so that is the reason. So most effective drug we are using in treatment of the leprosy. You know, in the leprosy we will not use the isoniazid. In the leprosy we will not use the pyrazinamide. We will use the rifampicin because it is having the maximum potentiality and it is having the maximum ability to kill the bacteria. So that is the very, very important one. And according to the question which was given in your exam, so the rifampicin goes to the correct answer. Okay, and this pyrazinamide, isoniazid also a bactericidal, but the maximum one is our rifampicin. Okay, so that was the correct answer. If your question was the bacteriostatic, so ethambutol is the only one bacteriostatic drug. Okay, only one bacteriostatic drug what we have. Very important, right? So hope it is clear to every one of you. And here is the next question. What is the first line treatment in the isoniazid induced peripheral neuritis? So the same question and the multiple time what we have discussed in our test series also, on our video classes also, on our my video lecture also. Okay, just 2 weeks ago. Okay, so just 2 weeks ago, so we have discussed regarding the all the important and golden points on the isoniazid. So I told this is the mycolic acid inhibitor. So this is the prophylactic drug of choice for the tuberculosis. So which is the having the like effect on the liver functions. Okay, so where it will causes the liver enzyme to get rise and the peripheral neuropathy. Okay, so I have told ATT, anti-tubercular drug, which is causing the tingling, prickling sensation, which indicates the peripheral neuropathy. So in this particular condition, okay, so we have to give them vitamin B6, or we can say the Benadon tablet, same name. Okay, Benadon also another name of the vitamin B6, and vitamin B6 we can give, or the pyridoxine. So the any one we can give, like same, all three are the same. Vitamin B6 also called as the Benadon and also called as the pyridoxine. Okay, so this is the treatment what we are giving in the very important isoniazid. So I told this one is the most common, and this is having the highest risk of asking in the exam. So that was striked in your exam, and this question multiple time we have given for the practice in your test series. Okay, yes. So here is the next like there is the important announcement for who all are preparing for the Norcet 10 and who all are preparing for the upcoming CRE senior nursing officer and upcoming RB nursing officer, and who all are wants to join the NIMANS as a nursing officer. For all of you all and anyone who is preparing for the state government, central government, upcoming KE Karnataka staff nurse exam and anything, if you want to prepare, so please do purchase this particular A1 plan. So where we are giving a daily live test till the next Norcet exam, and which including the RRB test series also. Along with that, you are getting subject wise test series. Nowhere, no coaching center in India. Yes, there are many coaching centers, they are giving the subject wise test series, but I am giving topic wise test series. Sir, how? If you are reading the or understanding the lecture on the myocardial infarction, there is one test which we have designed completely on the myocardial infarction. So like you are clicking on the MSN folder, in the MSN folder you are clicking on the cardiology. In the cardiology you will get a separate test for the myocardial infarction, separate test for the heart failure, separate test for the angina, separate test for the like all other cardiac diseases, valvular heart disease, everything in perfect, in properly planned manner. So just no book also, nothing also required if you are a part of this A1 plan. Okay, so what all you are getting in the A1 plan? So yes, you are getting the daily live test series. Okay, so along with that the subject wise test series, which including from the very basic to the very advanced questions. So that is how, that is the topic wise. So you will click the on the OBJ file. On the OBJ file you will click if you want to practice the question from the abortion. Okay, so again there is in the file inside the OBJ abortion. Okay, click on the abortion, all the questions, all the important possible questions, practical questions, one-liner questions on the abortion you will get. So like this we have completely designed the test series for you all. Okay, this will start from the first date of this particular month only. Okay, so very important, keep in your mind. And the subject wise classes with notes, PDF notes, the very important one. If you want PDF notes and the subject wise classes, almost all major subject will be there, like covered by me, and this is a integrated approach. If you finish this particular course, A1 course, if you one time finish it, means you definitely clear the upcoming Norcet exam. You will 100% clear the RRB exam. You are assured 100% you will clear the CRE exam and NIMANS exam. Any state and central government exam you are preparing for, this course is best for you all. Here we have started from the very basic to the very advanced, and the daily important recorded video lectures will be available for you all. You can watch the lectures and you have the very important questions on this particular lecture. You practice the lecture and you take the handwritten note. If it is not possible for you, you are working, so you can just have the ready-made notes, that is the PDF notes is available. So after watching the class, revise the PDF notes 2 times. Okay, and at least take a short notes from there, and wherever whichever we are telling important, you can just filter out that one. You can prepare a short note for the rapid revision at the end. Okay, so you can utilize this one like this. This will be giving a best result, and for our Norcet 10 exam and for our RRB exam, CRA exam, and any state and central government exam which you are going to face in the next 6 months, this is the Rama Bana for that one. Okay, please utilize this one. Okay, so without wasting a time. And here is the again one more plan we have, that is the No, sir, we have already done the coaching from somewhere else. Okay, just we want a daily live test series and the subject wise test series for the better practice. Yes, we have the plan A2. In the plan A2, so you will get just daily live test series. Okay, so which is very important one. Norcet pattern and the RRB pattern. Okay, and the subject wise test series also you will get here. Okay, so same I told. First you will get the MSN subject, then the OBG subject, psychiatric subject. On the psychiatry you are clicking means you will get all the questions like separate questions for the ego defense mechanism, separate questions for the antipsychotic drugs, separate question for the lithium, separate question for the ECT. Okay, so separate test series you will get. You can just practice means it will give you a next level of the confidence. If any kind of the question which is striking from the particular topic, you are very easily you can able to solve that particular questions. Okay, you will get that one. So this is a part of the plan A2. Okay, in the plan A2 there is no classes will be there. Okay, in the plan A1 you will get the classes plus PDF notes plus subject test series plus daily live test series. Okay, so this will be very much helpful for you all, right? So this will be helpful for all the state and central government exams. So no, we have already done the coaching. We just want the test series means this. The plan A2 is very much helpful and beneficial for you all. Okay, so here is the next question. Which of the following drug is commonly used in the neuropathic pain? So in the neuropathic pain, which of the following drug is commonly used? So in the neuropathic pain, the drug of choice is the gabapentin was the drug of choice. Okay, so we can't give the diclofenac, ibuprofen, acetaminophen. These all are the NSAIDs. NSAIDs will not helpful for reducing the neuropathic pain. Neuropathic pain will be due to the nerve irritation. But these all NSAIDs will reduce the pain by decreasing the prostaglandin effect. Okay, so there is no any role of the prostaglandin in the neuropathic pain, right? So in the neuropathic pain, no prostaglandin is role, so we will not use the NSAID. So best drug for the treating the neuropathic pain is the gabapentin. So this is your very important question. Again, it is having this chance to get strike in your upcoming next Norcet exam. Okay, so please be aware of this particular question. The drug of choice for the neuropathic pain is the gabapentin. Okay, so that is the very important one. And here is the next question. What is the commonest and early sign of increased intracranial pressure in the infants? Okay, so in the infants, in the children's, the earliest and the commonest sign. So the same question which was asked from our rapid revision classes just 8 days before the exam. Okay, so whatever the class we have hit on the YouTube, so that is the increased ICP. The first sign, the earliest sign overall in the adults is the altered level of the consciousness, and in the children and infants there is the projectile vomiting. So I have just described before just before your classes exams. So that was the question which was struck in your exam, and the projectile vomiting is the earliest sign and the first sign which we'll see in a case of the increased intracranial pressure in the infants. The very important question. Okay, and here is the next question. So what is the age group of the children eligible to receive the eligible to receive under the ICDS scheme? So students, the children age group criteria under the ICDS scheme. So this was the question which was asked from the national health programs. I have dealt all the important national health program just 4 months ago. I have posted the video, and the second part of the video also I have posted recently only. So in that one, from the 2 videos you got the 4 questions. I think from the Poshan Abhiyan one question was there, I think. Okay, from the ICDS scheme the question was there, and the this one by digitalizing the health mission ABA question was there. Okay, and the 5 lakh rupees question, that one was there, and along with that the Pradhan Mantri JSY one question was there. Okay, so I think 6 to 8 questions in the Navagraha plan. You people have the 4 videos. From the 4 videos you are getting 8 questions. So what else you want? Yes, just tell me what extra you want. From the 4 videos only you are getting the 8 questions. So that is more than enough to give the best shot in the exam to bring the result, right? Yes. So portion I have dealt, and portion 2.0 I have dealt all the updates and integrated programs in the portion 2.0 also we have discussed. So that was tracked in your exam, right? So wherever the quality is there, without compromising the quality, yes, you can believe in that one, trust on that one, practice that one, it will give the result. Okay, yes, 1,000 of your friends will get select in this particular Norcet, assure me. Okay, so I am very sure that the 1,000 plus of your friends, students will get select in this particular Norcet exam, okay, because they have practiced the quality content without compromising anything and with true dedication and the perfect dedication. Okay, so that's the very important one, right? So this in the ICDS target group I have told are the group which was included as the children's which was 0 to 6 years, both boys and girls, both boys and girls both are included. Okay, so this was the thing what we have discussed before the exam, and that was the thing which was struck in your exam. Okay, 0 to 6 year was the very important question which was struck in your exam, right? Yes, so here is the next question. Okay, same I told from the Ayushman Bharat digital mission. So this was also we have discussed before the exam only. Okay, so Ayushman Bharat health account and Ayushman Bharat digital mission. So I have discussed. So particular main aiming of the Ayushman Bharat digital mission is to digitalize all the healthcare workers records. Okay, this was just before 1 month before your exam. Okay, who all are taken the notes and who all are revised the notes. So they got the marks. Okay, that is a very simple one. Okay, we know what to give before the exam and what to hit before the exam. So that was all the core area. So I have revised it. So if people are a part of that one, yes, this was the result. It will comes now in very soon, right? So what is the main objective of the Ayushman Bharat digital mission? To digitalize the health records and to create the unified digital health ecosystem. So this was the correct answer which was there in your exam. Okay, so just to digitalize the health records of the public also, that if that one was also there in the option, so that is the correct answer. Okay, just the main aim and purpose of the Ayushman Bharat digital mission is to digitalize all the health records and to reduce the paperwork. So this was the concept many time I have repeated during the explanation of the ABDM. Okay, so that is a very important, right? So this was the next question. Okay, a 28-year-old primigravida woman at 34 weeks of the gestation presents with a severe headache and the visual disturbances. So what happened? Severe headache is there, visual disturbances is there, swelling in her hand and face is there, and her blood pressure is 160 by 110 mm/g, and her urine dipstick test showing the +3 protein. What is the most likely diagnosis? The same question multiple time you practiced, and the same question from your rapid revision video. You can say the preeclampsia. Okay, in the rapid revision video we have discussed. So in this one I have told regarding the characteristics of the severe preeclampsia. The blood pressure is more than 160 by 100, and there is in the sign of the end organ damage. What they have given in the options like there is in the severe headache, visual disturbances, swelling in the hand and face, and the her blood pressure is 160 by 110. Okay, so here is the 160 by 110 is there, right? And the sign of the end organ damage is there, and I told proteinuria is present in the both. In the mild preeclampsia also, in the severe preeclampsia also, proteinuria is present in the both, but the sign of the end organ damage which is present only in the severe preeclampsia. So in your option there is no any mild and severe preeclampsia. Just in your option there is the chronic hypertension, pregnancy induced hypertension, eclampsia, and the preeclampsia was there. Okay, so this is the 100% correct answer goes to the preeclampsia. Okay, if along with this particular all the symptoms, if there is in the presence of the seizure, if there is a presence of the seizure, so that then that time the answer goes to the eclampsia. So there is no anything just mentioned regarding the seizure. They didn't mention anything regarding the seizure. So there is no any mention regarding the seizure. There is no any answer called as the eclampsia. So the correct answer for this particular question goes to the preeclampsia is the correct answer. Hope it is clear to every one of you. And just I think 1 week or 2 weeks before the exam we have done this one in the rapid revision session. So this is the result of that one, right? So here is the next question. Yes, so same concept what I have explained in the class. Okay, similar thing, just I didn't remember all the options. Okay, so but the correct answer I remember, so I am showing in front of you. Okay, so this was the monitoring the beta HCG level. A weekly was your option. Okay, weekly need to monitor the beta HCG level. So this was there in your option. Okay, so question was, a 23-year-old woman underwent a suction and evacuation for the complete molar pregnancy 6 weeks ago, and abdominal X-ray shows there is no any evidence of the fetus. That is like what is the next best step? Okay, dear students, during that time there is no any evidence of the fetus inside, means the uterus is completely empty now. Okay, but previously she have a molar pregnancy, for that one suction and evacuation done. Okay, so what is the next best step? So I told you people in the crash course only. Okay, just in the rapid revision sessions, we have boosted all the criteria. Okay, so what is the first line management of the molar pregnancy? I have told. So suction and evacuation was the best answer, I have told. And after the suction and evacuation, what we have to do, that one also I have told. Weekly BCG monitoring, so beta HCG monitoring, and it is coming to the normal, then monthly beta HCG monitoring for the duration of the 6 months, and for the duration of the 6 months, the sexual intercourse is contraindicated after the molar pregnancy, I have told. Okay, so the question have been came from here. After suction and evacuation, what we have to do? After the suction and evacuation, weekly beta HCG monitoring we have to do. So this was the question which was struck from our a very important rapid revision video of the OBG. Okay, hope it is helpful to you all, right? So hope it is very much helpful for helpful to you all in the exams. Okay, so yes, so the next question is here. The thing we have discussed during discussing the physiological and pathological anemia in the very important pregnancy. Okay, so what is the target hemoglobin level aimed for a children's, adolescents, and the pregnant woman under the Anemia Mukt Bharat program? Students, if the hemoglobin level going less than 11 gram per deciliter, so we call that one as the pathological anemia in the pregnancy. So for that one, we requires the treatment here. Okay, so till the 11 is the normal one. Okay, so the target is to maintain the hemoglobin level more than 11 gram per deciliter is the target of the Anemia Mukt Bharat program. Okay, so this is the correct answer. At least we need to maintain the at least 11. Okay, so this is the cutoff one. Okay, hope it is clear to everyone of who all are chosen the 11 gram per deciliter as the correct answer. That is the correct answer. Okay, so the next question is here. Yes, the same question from the psychiatric, what we have discussed in the master batch. Okay, and there were the 4 to 5 questions from the rapid revision session, like from the transvestism, what we have discussed in the final touch video. Okay, so from the question was there. Okay, and in your prelims transference, counter transference was the questions directly struck. Okay, so the question was, a 30-year-old male with schizophrenia patient says the shock are passing through the blood to all over the body that are controlled by my neighbors with a machine with a machine to kill me, and they creating the pain in my stomach which is not my pain. Okay, so this was the question, and what happening in this particular scenario. So he is telling whatever his soma is there, whatever his body is there, it is under another, or it is under the control of their neighbors. Okay, so it is not, he is not using that one actively, so it was manipulated by the neighbors, means he is telling the complaining of the somatic passivity. Okay, so this was the correct answer. All are chosen the correct answer, somatic passivity. So that is the correct answer. It's not in persecutory deletion, it is not in thought insertion, it is not in thought withdrawal. Okay, so in your Navagraha plan, there is on the video called as the schizophrenia. In the schizophrenia 2 videos I have 2 or 3 videos are there. Okay, so 3 questions came. One from the Kurt Snyder first rank symptom of this schizophrenia, the question was there, and one from the very important schizophrenia patients like form of the thought questions was there. Okay, so from the like mental status question, mental status examination question was there. From the many questions from the psychiatry which was typed in your exam. Okay, one more question on the dialectical behavioral therapy. So that was the question was there in your exam. Okay, so yes, so this answer for this question goes to the correct answer. Which of the following describes the inadequate pelvis in the vaginal examination? Students, while discussing the female pelvis, so I have told you people that the pelvis with a prominent ischial spine is very dangerous. Pelvis with a prominent ischial spine makes the pelvis to get constrict, and which is not an adequate pelvis for the normal vaginal delivery. So which is the inadequate pelvis? Okay, which of the following is described the inadequate of the pelvis during the vaginal examination? If you are doing the paravaginal examination and if you are trying to touch the ischial spine and you are easily touching that one, means that is the constricted pelvis. Okay, so easily palpating symphysis pubis, sorry, it is not in the symphysis pubis. So there is the one more option was there, there is the prominent ischial spine. So that was the correct answer, right? So unable to touch the sacral promontory, that is the good, and movable coccyx, that is also good, no problem. And easily palpable symphysis pubis, the lower part of the symphysis pubis you can palpable easily. Okay, and most importantly, ischial spine prominent, ischial spine prominent, if this was there in the option, so that is the 100% correct answer. This is the inadequate pelvis, what we can say. Okay, so that's the very important one. The next question is here. I didn't remember the two more options, but the answer in these two options only. So try to understand this one. The stenosis of the foramen of the Lusca and Mezendi is seen in which of the following congenital malformation? So this is the question which was asked from the neural tube defect. Students, there are total, I think, three questions. One is from the myelomeningocele, one is from the this one, what we can say, raised ICP, and another one is from the hydrocephalus. Okay, so in the hydrocephalus only we will study the communicable and communicating and non-communicating hydrocephalus. In that one we will study the different syndromes. Okay, students, by congenitally, if the foramen of Lusca and Mezendi is getting narrowing or stenosing, so that is a very important syndrome, what you call as the Dandy-Walker malformation. Okay, so in the Arnold-Chiari malformation, what happens in the Arnold-Chiari malformation? Okay, so this is the skull. Okay, at the base of the skull, so there is in the hole, we call this one as the foramen of the magnum. Okay, and from here the spine will starts like this, right? If the brain tissue or especially the brainstem which is there here, if it is abnormally get protruded or the prolapsed out from this particular foramen of the magnum, we call that one as the Arnold-Chiari malformation. Arnold-Chiari malformation means the brain tissue is protruding out through the foramen of the magnum. We call that one as the Arnold-Chiari malformation. The congenital stenosis of the foramen of the Lusca and Mezendi is a very important question, and which was struck in your exam. That is the Dandy-Walker malformation was the question. Okay, and along with that, we have the next question here, which was the very important question, right? In the spinal defect at the lumbar area with the protruded sac was there. Okay, so which contains the spinal CSF, and the neural tissue was also there in that option. Okay, so the sac is there. Okay, the sac is there, plus CSF is there, plus neural tissue means there is the nerves are there. So that is the myelo means nervous tissue, meningo means meningeal layer, seal means cyst. Okay, so sac or cyst is there and CSF is there, nerve tissue is there. Okay, so this is the myelo, meningo, seal goes to the correct answer. Okay, so who are chosen the myelo, meningo, seal as a correct answer? Your answer is 100% correct. Okay, so hope it is clear to everyone of you, right? So here is the next question. The same question from your rapid revision. So the options was little bit different, but if you know the very basic thing that the dose of adrenaline in the adult CPR, you know the answer for this question means you would have chosen the answer very easily, because all the other three options which was there in the options are in the decimal. Okay, like 0.01 was the one option, 0.01 was the one option, and the 0.5 was the one option. Okay, and 1 was the one option. So you know the dose of the adrenaline in the adult CPR, so you would have given the correct answer for this question. Okay, if you don't know anything other, next thing. Okay, so what was the question which was asked in your exam? In a patient with a shockable rhythm, that is it may be ventricular fibrillation or the pulseless VT. Okay, after the 3 shocks and ongoing CPR is there. Okay, what is the correct dose of the adrenaline to administer next? So the correct dose of the adrenaline to administer next after the 3 shock is that is the adrenaline 1 gram is the standard dose which requires for the during the adult CPR. Okay, so this is the, if you know this particular only one point, there is the dose of the adrenaline in the adult CPR, so you would have chosen the correct answer. And already which was discussed a question in the rapid revision video, I think 7th video, you can just open the video, and all the dilution of the adrenaline, everything I have dealt in detail in that particular. Okay, yes, so the next question is here. Yes, the question is here in front of you all. So the total 2 questions are there from the postpartum hemorrhage. Okay, that is 2 from the oxytocin dosing only. Okay, yes, a woman presents 2 weeks after the delivery with the postpartum hemorrhage at the primary health center. Okay, so she is having the secondary PPH and she comes to the PH now. As a nurse on duty, what is the first step you should take before referring the patient to the higher hospital level? Okay, so before sending the patient to the next hospital or the higher hospital, what is the step you will take here? Okay, so that one, like as per the doctor orders, so we will start the intravenous fluid. Okay, because she is having the bleeding, and as per the order, we will give the uterotonics like oxytocin. We will administer here. So we will refer the patient to the further next hospital. Okay, so that's the always first line treatment Okay, always the first line treatment for the PPH is the oxytocin. The many time we have discussed the question in our rapid revision. Okay, so recent videos only, I think the videos like last fourth video only we have discussed the PPH and the first drug what we are using in the PPH, everything. Okay, yes, that is the very important. Two questions were there from the PPH. Okay, and this was the question, and many of you are chosen the wrong answer. Yes, just you have seen the question that or to deliver the head of the baby, that's it, and choose on the Burn Marshall manual. Better, the question was not asked in the breech delivery. They have asked the question that which of the following manual is commonly used to assist the delivery of the fetal head during the normal vaginal delivery. The Burn Marshall manual is used to remove the after coming head in the ABD. What is the ABD? That is the assisted breech delivery. Okay, means to deliver the each and every part of the body. So we are doing the maneuvers. We call that as the ABD or the assisted breech delivery. In that one, the head will come last. In the normal vaginal delivery, head will come first. In the assisted breech delivery, the head will come last. So that is the reason after coming head of the baby, we will say. So to deliver the head in the last, we will use the Burn Marshall manual. But in the normal vaginal delivery, head will come first. So in order to deliver the head and in order to prevent the perineal tear, so we are using the very important manual, that is the Ritzgen manual. So who are chosen the correct answer as a Ritzgen manual, your answer is 100% correct. Okay, this is the 100% correct, right? So that is the reason, dear students or dear my dear aspirants, I used to told repeatedly to please read the question completely, try to understand the question, then respond to the question. Okay, so just reading one highlight word and answering the question going to damage you, you know that, but still you are doing the mistake. So that is your mistake. Okay, so please do come out of this kind of the dilemmas, right? So the next question was like this. This was the question which examiner just want to like destroy the concentration of the students. That's it. Okay, so in the image they have given the like similar like image like this was there in the exam, and here was the JUP was distended. Okay, so the distended jugular venous was there. So jugular venous distended means which indicates both the hypervolemia also and fluid overload also, but both are there in the option, right? So but we will go for the correct answer is the fluid overload. Why? Because this word indicates the fluid is congested and the fluid is overload. Hypervolemia, it may be a circulating one or non-circulating one. Okay, so yes, so but the aims may give the bonus marks. Okay, so for this question, because the options was given was the very much like not authenticate options, we can say, right? So the next option is here. So the next question, what is the abbreviation of the INAP commonly stands in the neonatal care? So this was the question, INAP. So already discussed the question in your national health program in the Navagraha plan, right? So very importantly, so what we are doing in the INAP, that is the Indian Newborn Action Plan was the full form of the INAP. So who will have chosen the answer as the Indian Newborn Action Plan? So that is your correct answer, beta. I think almost all the students of the Navagraha plan have chosen the correct answer, because in the third or the fourth video, the first question was on this one, right? Yes. So what does the abbreviation of the INAP commonly stands in the neonatal care? So INAP stands as the Indian Newborn Action Plan. It's not an like intensive, it's not an initiative, it's not an immediate. Okay, so that is the correct answer is option B. Hope it is clear to everyone of you, right? So the same IBQ, it was asked in your Norcet 8 also. Okay, I think in the Norcet 8 prelims, same question was came in your exam. Again the same feeder, okay, in the patient with the cleft lip and cleft palate. So we are using this instrument to feed. So what is the name of this instruments? Okay, so this instrument's name is called as the Haberman feeder. Okay, same it was struck in your Norcet 8 also, and it is came in your Norcet 9 mains also. Okay, same to same question was there, nothing was difference. Okay, yes, so this is the Haberman feeder. Who all are chosen the correct answer, that is the 100% correct answer for you all, right? So the next question, yes, so the question was there on the Apler syndrome, that is the anti-phospholipid antibody syndrome. Already we have discussed this one. Okay, so Apler syndrome and the some OBC new guidelines. So new updates on the Apler syndrome, which is came recently on the OBC also, I have posted. Okay, so that Apler syndrome in detail we have discussed all the lab values and all the clinicals associated things like the recurrent abortion, which is more than 2 times. Okay, so previously that was the 3 times, now it is more than 2 times. The Upload syndrome already we have discussed in the rapid revision video. Okay, yes, a 25-year-old woman having the 2 times recurrent abortion first trimester and USG all investigation, and the parameter shows the normal and some elevated antiphospholipid antibodies there. Okay, so seen causing the recurrent abortion. So this is the antiphospholipid antibody syndrome, or we also call this one as the Upload syndrome. Okay, so that is the very important question, directly strike from the our crash course video, and the question which was there in our test series also. Okay, yes, this was the correct answer, and this was the image based questions. So V obstetric drape, we can say this one has in the V obstetric drapes. Okay, so this was the correct answer. Okay, so this is also called as the obstetric drapes, drapes or the V obstetric drapes. Okay, so this particular drape means the plastic portion we will keep at the like back of the patient, and this one we will hang over the like foot end of the OT table. Okay, so if any secretions which is coming and any other like sudden burst of the fluid which was there, so which will get collects in the this particular drape sheet. Okay, so this was the V drapes, or we also call as the V obstetric drapes, who are worked in the OBG OT. So they have given the correct answer for this one. The same question, so which was tracked from your I think OBG disease book. Okay, so that's the very important one. Okay, here is the next question. What is the target preductal oxygen saturation in healthy newborn at the 1 minute? The question which was already discussed for from the Raghav sir in the master batch 1.0, the target SpO2 levels. Okay, so the target SpO2 level at the 1 minute of the life is the, that is the 60 to 65, and these are the preductal oxygen saturation targets up to the birth. Okay, so very importantly, at the 1 minute of the lifetime, 1 minute life, so 60 to 65. At the 2 minutes life, it's on the 65 to 70, 3 minutes 70 to 75, 4 minutes 75 to 80, and the 5 minutes 80 to 85, and the 10 minutes 85 to 90. So at the 10th minute it will come for the more than 90. Okay, so till that it will be less than 90 only. Okay, the question was asked at the 1 minute of the life, so the answer will be the 60 to 65, who all are chosen the correct answer. So that is the 100% correct answer for you all. Okay, so that is the 60 to 65 is the 100% correct answer of the preductal oxygen saturation of the healthy newborn. Okay, so that is the very important one. And here is the next question. During the suctioning of the patient, the nurse notices the decreased SpO2. Okay, so that was in the question that there was mentioned from the 94 to 88, 84 it is decreasing, and increasing in the wheezing sound is there. What is the most likely cause? Students, during the like suctioning, if it irritates the mucus and if it causes the sudden any wheezing and like sudden drop of the saturation, that indicates the like due to some allergy or due to some irritation, the bronchus and the larynx have been spasming here. Okay, so which indicates the bronchospasm and the laryngospasm, which not indicating any pulmonary embolism, nothing. Okay, so whoever are chosen like during the suctioning, the wheezing sound is increasing and the SpO2 is decreasing, means that is the bronchospasm or the laryngospasm goes to the correct answer. Okay, so that is the 100% correct answer, right? And the next question, on the survey graph, labor is considered as abnormal when the cervical dilation crosses which line? Yes, when the cervical dilation crosses which line? So we will consider that one as in the abnormal. Yes, we will consider that one as in the abnormal when the cervical graph crosses the very important action line. If it is crossing the alert line, no problem, but if it is crossing the action line, that indicates the problem. Okay, so there are the action line and alert line which was there in our what we can say Partograph. Okay, so in the modified WHO Partograph, from there it is question, and here the 4 hour gap will be there, and here the 4 centimeter dilation, from there it was starts, but in the labor case guide the graph will start from the 5 centimeter. Okay, so you can remember that one. And very importantly, this is the alert line and this is the action line when the cervical dilation which starts, okay, which crosses the our action line. So that time we need to take action, and because it is the labor is progressing abnormally. Okay, so whoever chosen the action line as in the correct answer, your answer is 100% correct. Okay, so the next question is here. A 35-year old pregnant woman comes for the routine antenatal checkup which of the following cancer is at the she is at highest risk of developing during the pregnancy? Students, you know the breast cancer is completely dependent on the amount of the estrogen. Wherever there is in the increased estrogen, there is risk of the breast cancer, right? So same question which was striked in your exam, the breast cancer goes to the correct answer. Okay. So and again one more question was there from the like which is the most common leading which is most common current cancer in the India according to the 2020 cancer reporting system report. Okay, so according to that one, the most common cancer in the Indian female is the breast cancer. Previously that was the cervical cancer, now it's reduced, so that is the in the oncology class second. Okay, so I have told the most common which is there in the India in the world, and most common which is there in the in the female in the world and the male in the world and the India. Okay, so everything I have discussed in the oncology in the Navagraph plan. Same question have been struck in your exam. Okay, so still the videos are there. Who are subscribers of the Navagraph plan, so you can cross check out on the oncology. Okay, yes, this was the question directly struck on your exam. Okay, so hope it is clear to every one of you. Basic knowledge is most important for cracking any central and state government exam. That is the main thing you have to keep in your mind. Okay, so India is the first country in the world to introduce which of the following national health program? Dear students, this is the question where while starting the national health national family planning program, so I have told you people the first word I have told you people that the India, the Bharat is the first and the primary and the very first country to start the national family health program. Nowhere in the world the national family health program was introduced, so it was first introduced in the India only. So the national family planning program was the first program which was this is the only program which is first time introduced by the India. Okay, so oldest program is the, as compared to the national family planning program, national malaria control program is older than this one, but they have asked the question which program is first introduced in the India. So malaria program was introduced in the other countries also before initiating of us, but the national family planning program is started first time in the India only. Okay, India is the first country to start the national family planning program. Okay, so this is the correct answer. Hope it is clear to every one of you, right? So the next question is here. Yes, a 28-year-old man visits the clinic with the concerns about his repeated desires to dress a woman's clothing, and he reports that the wearing the other supposed clothes which gives him a calm and the happy results, and but he denies to be desired to change his gender. Students, this was the question, and in this question also they mentioned that then by wearing the opposite gender clothes he used to masturbate daily also. Okay, but he don't want to convert his gender from the male to female. So I told in the transvestism disease, just he will wear the opposite gender cloth and he will feel that one, and he will remove the clothes. Okay, he don't want to convert from his male gender to the female gender. So that is the transvestism disorder. So in the final touch video already we have discussed. Along with that, in the OBG same to same scenario questions, in the psychiatry same scenario questions you people have already seen in the master batch 1.0. Okay, so the next question is here. Yes, multiple time repeated question on the akathisia, and one question was there in our prelims also regarding the akathisia. Okay, so that is the inability to sit still. So the same question. Okay, so before the prelims I told you, before the mains I told you people, yet there is a chance of one or two questions which will strike from the prelims to the mains. So akathisia was the question which was asked from the prelims in the mains. Okay, so that is a very important one, right? The patient started on the haloperidol, develops the feeling of the inner restlessness and inability to sit still. Okay, within a few days of the treatment, what is the most likely diagnosis? So that is the akathisia is the most likely diagnosis. And one question was there from the tardive dyskinesia also. There is the lip smacking, okay, and the facial expression. Okay, so in that one, which one you have used to give the drugs? That is the triaxiphenidine was the your answer. Okay, so THP. Okay, so THP was your answer. The same concept what we have discussed in the master batch. So psychiatric completely dealt by me. So in detail, in perfect, in each and every corner. So I have touched on. So the same questions have been struck in the exams. So what you want extra, right? So this is the thing just you want for your selection. And here's the next question. Okay, so a nurse is preparing a patient for the mitomycin intravesicular therapy. Okay, what happened? Intravesicular means inside the bladder we are giving the chemotherapeutic drug, that's the mitomycin. Okay, and for the bladder cancer we are treating. So which of the following instructions should be the nurse give to the patient to prevent the complications, right? So yes, so that this question was not to prevent the complication. So just which of the following like instruction. Just a second, please. Please wait, students, for 1 minute. So I will continue with this one. Okay, just be on in connect only. Okay, just technical error I am solving. 1 minute, 1 minute, just 1 minute. Yes, done. Okay. This question is not related to the done. 1 second. Yes. So this question is not related to the yes, this is the question. Okay, so which is not related to the complication, which is related to the like what is the nursing instruction to be given. Okay, so if we are giving the mitomycin by the intravesicular and patient is urinating, that one means all the medication will comes out. So we will ask the patient to avoid urination for at least 2 hours after the insertion of the medication inside the bladder. So this is the answer what we have to give to the very important patients. Okay, so here is the next question. A population pyramid with a broad base and the narrow tip, which indicates the population pyramid which with a broad base and the narrow tip, which clearly indicates there is in the rapidly growing population with a high birth rate and the high death rate. Okay, if this was not there in the option, okay, so if this was there in the option, this is 100% correct. Okay, which clearly indicates this particular answer only. Okay, yes, the next question is here. Diabetes type 1 children, definitive management is the, yes, in the diabetic type 1 children, you know, in the type 1 diabetes, what happens? There is in the problem of the pancreas. Okay, there is the problem of the pancreas. So pancreas is getting problematic, means there is decreased insulin. Okay, so there is decreased insulin. So there is insulin is decreased, means what we have to do? We have to replace the insulin externally. So the drug of choice for the type 1 diabetes is always insulin. Okay, in the type 2 diabetes, there is in the cell, okay, around the cell fat is there. So the insulin is there, but it is not getting sensitized. So that is the type 2 diabetes. But in the type 1 diabetes, it is in the insulin dependent diabetes. The drug of the choice for this particular question was the like the answer of the best answer for this particular question is the insulin. Okay, so here is the next question. Yes, here is the next question. Done. Before administering the general anesthesia, the nurse explained to the patient that atropine is given to what? So what is the reason for giving the atropine before administering the general anesthesia? Students, option is telling reducing the secretion and preventing the aspiration. So this is the correct answer. The primary purpose of giving the atropine before the anesthesia is to reduce the secretion and prevent the aspiration. So this is the correct answer. It will not increase the blood pressure during the surgery. It will not relieve the pain during the surgery, and it will not induce the muscle relaxation. So we are giving this one primarily for the purpose of the making it to reduce the secretion. There is no secretion means there is no risk of the aspiration. That is the very important one. Okay, so this is the question which was directly struck in your exam. And here is the next question. There were the total 2 questions on the herd immunity. Okay, so in the previous last Norcet 8 also there is 1 question from the herd immunity. Okay, so similarly in this particular Norcet 9 there is 1 question from the, so there are 2 questions from the herd immunity. One is to regarding the what is the true statement regarding the herd immunity, and another one is to which disease is not covered under the herd immunity. Okay, so there are the 2 questions. Which of the following statement about herd immunity is true? Students, herd immunity is effective only when like it occurs when the high percentage of the population is immune to reducing the particular disease. Okay, so that disease was previously endemic in that one area, and all the area populations are already having the immune cell against that disease. So that time in that particular area that disease will never exist, because all the population of that particular community is having the immunity against that one. So that is what we call the community immunity or the herd immunity. Okay, so this herd immunity we also call as in the community immunity. Okay, so this herd immunity we also call this one as in the community immunity. Okay, so that is the all the community peoples are having the antibodies against that particular disease. Okay, so in this one TT is not tetanus is not included. Okay, so that's the very important one, keep in your mind. And 100 gram of the pure protein will be seen in the egg. Okay, this is a direct question from the nutrition. Okay, simple question. And here is the next question. What is the route of administration of the rotavirus vaccine and why it is given? So dear student, route of administration of the rotavirus vaccine and the dose 5 drops was asked in the prelims also. Okay, it was there in the mains also. Okay, so oral route we are giving to prevent the rotavirus induced enterogastritis is the correct answer. If this was there in your option and you have chosen the correct answer, that is the rotavirus vaccine is given to prevent the diarrhea by preventing the rotavirus induced gastroenteritis, because this rotavirus only the most common cause of the diarrhea in the children is the rotavirus. Rotavirus is the most common cause of the diarrhea in the children, and we want to reduce the gastroenteritis that is causing by the rotavirus. So that is the reason we will give the rotavirus vaccine 5 drops orally. Okay, to prevent the rotavirus induced gastroenteritis. So this is the correct answer. Okay, and here is the next question. Like herd immunity is not typically effective in controlling which of the following disease? Okay, so herd immunity is not typically effective by controlling which of the following disease? I told tetanus is not a part of the herd immunity. Okay, so like in the tetanus we need to go for the immunization, everything we will expose for the any cut and injuries. Okay, so it will not produce as the herd immunity. Okay, so that is the very important. Tetanus is not a part of the herd immunity. Very important question. And one more question on the like by maintaining the abstinence. So in the alcoholic patient, okay, so to maintain the abstinence, so there are the total 3 questions which was taken from the our drug abuse topic. Okay, so one is from the nicotine. Like, so I told you people definitely from the nicotine 1 question will comes. Okay, the cut, chew and park technique. Okay, so just the patient have to cut that one, chew that one and park that one in the between the buccal mucosa. So that question also was there in your exam. And the a very important abstinence maintenance 1 question, that is the naltrexone question, and 1 more question on the using of the our disulfiram. So that is the aversion therapy. So total 3 questions from the 1 video. So you can refer till now, the video is there on your YouTube only with the name called as the a special class on the drug abuse. Okay, so 1 class 3 questions, 1 class 3 questions, and the national health programs 1 class 2 questions. Okay, so all the special classes what I have hit, so from everywhere the question have came, and I am very grateful and thank you to every one of you first of all for believing in the content of the master nursing classes. So this is how what we are proving, and this is how what we are growing. Okay, so stay connected with the master nursing classes, even you become a nursing officer. Okay, so keeps on learning. Okay, so keeps us to get motivates. Okay, so yes, we are always here to improve our profession, and any one of you are preparing for the I told for the Norcet 10 exam, and any one of you want to prepare for the RRB exam, SGPJ exam, KGMA exam, and any state and central government exam which will comes in future. Okay, so if you want to become a part of that one, I told the 2 plans. So that is the plan A1 and the plan A2. Okay, so better if you are a beginner, okay, you are starting from the 0, so please go with the plan A1. Okay, so which will start in the master nursing classes app very soon, and for all the further updates, okay, so I have given the link in the description box. for downloading our app and to download our so to join our WhatsApp group, so you can join from there. Okay, so thank you so much for watching the video till the end, and if anyone know the any more questions with the same options, okay, so please do mention in the comment box the question and option, so I will try to respond you all in the comment box. If the questions coming more and more, so I will take one more video on this one to solve the questions. Okay, so if you are believing in the quality content and the practicing the quality contents, definitely the result will be yours. Okay, so thank you so much for the watching the video till the end. Okay, so take care, bye bye, we will meet in the next video. Okay, so in the next video I will come with a jabardast plan for the Norcet 10 exams. Okay, if you are covering the and following that particular plan for the Norcet 10 exams, there is more than enough to clear your Norcet 10 exam with the top 100 rank. Okay, so thank you so much for watching this video. Okay, and if you want classes, test series, topic test, daily live test, everything, so join our A1 plan. Okay, just you want a test series, okay, join our A2 plan. So here you are getting the live test series plus subject wise test series. Okay, and for the A1 including the RRB test series also, Norcet test series also. Okay, and A2 is only including the very important our Norcet test series and RRB test series and subject wise test series. That's it. Okay, so thank you so much for watching the video till the end. We will meet in the next video very soon. Okay, so stay connected, keep motivating yourself. Okay, and hope for the best in the our upcoming result. Okay, so definitely students, whatever all are practicing the best from the master nursing classes, definitely result is yours. Okay, so I am waiting for your word, what you will type to me every time. Okay, what I got in the Norcet 7, Norcet 8. Okay, just this time also I want to get the message from you all that sir, I got selected. Thank you so much. Okay, so that's it. Okay, we will meet in the next video. Tab tak ke liye, Jai Hind, Jai Bharat. All the best and hope for the best result. Definitely we worked very hard, very best, and very with highest dedication. So definitely result will be ours. Okay, hope for the best. Stay connected. Okay, so we will meet in the next video. Bye bye, take care, love you all the best for your result.